ADHD does not excuse bad behavior, so let's remember that. But some of these strategies might help you as a parent to discipline them effectively and appropriately.
Hi, Dr. Dom. My name is Lisa, and I am the parent of Lily, who is 11 years old. Lily was diagnosed with ADHD and anxiety. My question for you is, what strategies do you recommend to use to discipline your child who has this medical diagnosis? I want to correct her negative behaviors, but sometimes I'm not sure if she's doing it on purpose or if it's something that she can't control.
So number one, I always tell parents the 3 C's: consistency, calm, and confidence. And this is you as a parent, being consistent, being calm, and being confident in your approach to disciplining kids with attention deficit hyperactivity problems. So first of all, consistency is key. So be sure to establish consistent routines and clear expectations. You have to be consistent with rules, and you have to be consistent with consequences. No. So consistency is very, very important. It's kind of hard sometimes as parents, but we have to remember that. Very, very important point too, and I know this is hard as parents because I'm a parent as well, is avoid disciplining with anger. And a lot of times we get to a point where we are so frustrated as parents that by the time we discipline our kids or ask them to do things, we do it with a tone of frustration and anger. Most research shows that yelling and anger does not have positive outcomes over time and actually does not help improve behavior.
Maybe Princeton will allow you to raise a little baby in your dorm room.
So do your best to remain calm, speak in a very clear, concise, calm, and confident tone with clear expectations, clear goals, and very simple, easy to follow directions. And you're gonna be on your way to helping your child with better behavior.
Hi, Dr. Dom. My name is Jennifer White. I'm a proud parent of a 15-year-old boy. His name is Brady, and he's been asking me to purchase supplements to help him gain weight and build muscle. And I just feel like he's too young. And secondly, the market is just flooded with all these supplements, and I don't even know what's safe or not. So if you can help me navigate through this, that would be wonderful. Thank you.
So I want you to think about a few things: lack of research, unregulated industry, potential dangers, and potential ingredients that are not listed because it's not FDA regulated, equal not recommended. Now, don't forget, there are over 200 banned substances for college and high school athletics. So there are circumstances where kids take over-the-counter supplements and they were tested and it turns out that they get banned from their sport because you didn't know what was in there.
If anybody finds out about this, we're all off the team.
There have been instances where over-the-counter supplements have peptides, hormones, excessive amounts of caffeine, stimulants, and other substances that might be banned, or you might have untoward effects or side effects that you weren't expecting. So based on that, as a minor, anyone under 18, I'd be really cautious with using supplements. But to add to this, I want to tell you guys, again, as a fitness enthusiast, as a young adult and an adolescent, your body is primed for muscle growth and activity and strength and balance. If you have a good diet, good hydration, and good sleep, you don't need them. So save some money, focus on the basics, and you're going to be just great.
Hi, Dr. Dom. This is JJ. I have an 11-year-old daughter. Talk to me about the balance to strike soft parenting versus being a tiger mom. I want to be the best kind of parent I can be for my daughter, and I'm not sure which is the better way to bring out the best in her.
So this tends to refer to a parenting style with very strict rules, very high expectations, intervening in your child's day-to-day life.
How does she always know?
There is no one-size-fits-all parenting approach. There just isn't, because effective parenting is based on individual needs, temperament of the child, and can vary significantly. But a very important point for this discussion is that there has been a lot of empirical data on successful parenting, what tends to work generally speaking, and what tends to have poor outcomes. So let's talk about those. So number one, What we call authoritative parenting seems to have the best clinical evidence for the best outcomes for your kids over time, setting clear expectations and limits and boundaries, but at the same time being warm and supportive and having open communication and creating what we call a positive parent-child relationship. Not always easy to do, and this certainly takes work, but the authoritative parenting style that I just described tends to have really, really good outcomes. Number two, we want to encourage independence in our kids. And if we're too overzealous with our parenting and we take too much control over our children's lives, obviously that's not encouraging independence.
We both know where this leads.
Also make sure, that you have balanced expectations. I always see parents that are very, very overzealous, have very, very high expectations of their children when it comes to sports or academics or instruments, whatever it might be. Make sure that you have balanced expectations, because if you're focusing and forcing children to be someone that they're not, that is going to backfire.
I can't do this.
I always say this with all parenting styles, open communication is the foundation of everything. So make sure that your child feels free to express themselves and talk to you without criticism and judgment, because if they stop talking to you, then you're really going to be in the dark and you're going to be in a lot of trouble with your parenting style.